All right, thank you, Emily. COVID-19 took the world by storm in early 2020, and earlier this year, the Delta variant emerged. Now, the Omicron variant has made its way to the U.S. and is a variant of concern. But what does this mean, and how can you protect yourself? Our Nixon Norman answers those questions.
There's a new variant in the air, and already health experts are concerned.
WHO has only designated 5 variants of concern in this whole pandemic, and so Omicron is number 5.
But what is a variant of concern? Well, according to the CDC, a variant of concern shows evidence of things like an increase in transmissibility, more severe disease, or reduced effectiveness of treatments or vaccines. And these variants, both concerning or not, are able to thrive in places where people aren't yet vaccinated.
When you have places where vaccination coverage is so low, they are fantastic setups for exactly this type of mutation to happen. And that's what we've been saying all along. This is not magic. We've been talking about how places with low vaccine coverage are going to be the most vulnerable to the emergence of these new variants.
So, what can you do to protect yourself? Well, the answer is easy.
Vaccinate as much as we can, not just in people who can get a booster shot, but really increase the rate of vaccination globally.
And as these variants, like the Delta or Omicron, continue to thrive, effectiveness of the vaccine may decrease against those specific strands. And although that is not the case now, Dr. Marrazzo says it's better to be safe than sorry when it comes to getting vaccinated now.
But I think most people who study immunity would say much better to have a baseline set of antibodies. So in other words, you don't want to be totally vulnerable and never have had antibodies to COVID when you meet this new variant.
Nixon Norman, Fox 54 News.